Hello, my name is Kate Medlicott, and I'm the Sanitation and Wastewater Team Lead at WHO. Welcome to the OpenWHO course entitled For a Healthier World, Safely Managed Sanitation. The world is alarmingly off track to deliver universal access to safe sanitation for all by 2030. Without universal access, the world will not claim the myriad health, environmental, and socioeconomic benefits that come from safely managed sanitation, or SMS for short. This course has 4 modules and is designed to help governments, development agencies, civil society partners, and others working with them to achieve safely managed sanitation for their populations. Through the 4 modules, we'll look at the state of the world sanitation, the health rationale for safely managed sanitation, what can be done at the national level, and tools to help you work with SMS. Each module includes a simple self-test to help you recall key information, and a certificate is provided upon course completion. After taking these 4 modules, you'll be able to describe sanitation's impact on health, economies, and the environment, describe health risks along the sanitation chain, recall the definitions for safely managed sanitation at each step of the sanitation chain, describe how to accelerate progress for sanitation for all, explain sanitation programming approaches to improve health impact, recall how to embed definitions for safely managed sanitation in national targets, legislation, regulation, standards, and plans, summarize how to access and use tools to assess sanitation situations, realize the role of the health sector in delivering sanitation, and facilitate for you and your colleagues where to find more in the WHO guidelines on sanitation and health and associated tools.
Welcome to Module 1. This introductory module of the course explains Safely Managed Sanitation or SMS in the context of the current state of the world's sanitation and is sourced mainly from the report of the same name, State of the World's Sanitation, an urgent call to transform sanitation for better health, environments, economies and societies, published by WHO and UNICEF in 2020. Through the report, WHO and UNICEF brought together for the first time the data on sanitation coverage and investment and how it impacts health, economies, and the environment. Citing evidence on what works from successful countries and global guidelines, the report charts an ambitious way forward through the SDG 6 Global Acceleration Framework, which you will hear about later. In 5 sections of this module, we will examine the health, social and economic impacts of poor sanitation, progress towards SDG Target 6.2, the status of policy and finance for sanitation, imagining a better future where a dramatic acceleration in progress is possible, and how governments can accelerate progress. The starting point for a discussion on sanitation is to acknowledge that it is indeed a human right. Everyone is entitled to sanitation services that provide privacy, ensure dignity and safety, and that are physically accessible and affordable in all spheres of life, and home, at school, in health facilities, at work, and in public places. To safeguard health, the environment and quality of life, everyone needs sanitation services that prevent exposure to unmanaged wastewater and harmful unmanaged waste. Yet today, the consequences of poor sanitation are stark. These consequences include illness and disease. For example, diarrhea, cholera, worm infections, and stunting. Poor sanitation is also a driver of antimicrobial resistance, a disproportionate effect on the most vulnerable peoples, thus exacerbating inequalities. Negative impacts on human dignity, safety, and gender equality. For women, people with disabilities, and sanitation workers, in particular. Financial costs, including healthcare costs, lost income, foregone educational opportunities, and costs resulting from environmental pollution. Sanitation is also a public good, as it provides benefits across society in terms of improved health, as well as economic and social development. Sanitation must be defined as an essential public service which is foundational for a healthy population and prosperous society. But to claim these benefits, governments must ensure access to all steps of the sanitation service chain, from the toilet to treatment and disposal to end use. So, what is the sanitation service chain? This expression contextualizes that our friendly toilet is, in fact, only the first step in delivering safe sanitation. What you see here is the sanitation service chain. It shows that safe sanitation is much more than out of sight, out of mind. In fact, it is an interconnected service chain from the time human excreta is created to the time it is safely disposed or beneficially reused. The chain vividly illustrates also that failures can occur at any step of the chain and result in negative health outcomes and pollution of the environment. That's why it is critical to ensure that risks are managed along the whole sanitation service chain, from toilets to containment to transport, treatment, and finally safe use or disposal of wastewater and other fecal byproducts. Achieving universal access to safe sanitation will be expensive, but inaction brings greater costs. For one, lack of sanitation results in greater recurrent and preventable healthcare costs, lost income and educational opportunities, loss of productivity and environmental pollution. Investments in sanitation, particularly safely managed sanitation services, avert these costs and generate positive externalities across society. In fact, the economic benefits of sanitation have been estimated at about 5 times the cost. The annual costs, including capital and operations and maintenance, from 2017 to 2030 to achieve universal sanitation would be $105 billion. This includes $36 billion for basic sanitation and $69 billion for safely managed sanitation. The total global average cost per beneficiary to gain access to safely managed sanitation is $24. This is an investment, not a cost. With less than 10 years to go for the SDG period, let's look at the progress that has been made towards achieving sanitation for all. The WHO-UNICEF Joint Monitoring Programme for Drinking Water, Sanitation and Hygiene JMP uses national data to produce internationally comparable estimates of progress on drinking water, sanitation, and hygiene, which are used to monitor progress towards the SDG targets related to WASH. All data presented here come from recent updates prepared by the JMP. From 2015 to 2020, the proportion of the global population using safely managed services increased from 47% to 54%. But 3.6 billion people lack safely managed services, including 494 million people practicing open defecation. At current rates of progress, the world will only reach 67% coverage by 2030. Leaving 2.8 billion without safely managed sanitation. In addition, 28% of schools still lack basic sanitation services, impacting 539 million school children, and more than 10% of healthcare facilities have no sanitation service whatsoever. Achieving universal access to sanitation by 2030 will require dramatic acceleration in current rates of progress. To achieve universal access to at least basic sanitation by 2030, global rates of progress would need to double, and achieving universal access to safely managed sanitation by 2030 would require quadrupling the current global rate of progress. But these are global averages. the required rate of change in least developed countries is even higher. To achieve basic sanitation in these countries, the rate of change would have to increase from an estimated 0.7 percentage points per year to 5 percentage points per year, a seven-fold increase. So the global averages can hide these regional, rural, and urban and wealth disparities. It is worth noting that while the world appears to be on track to eliminate open defecation, much of the progress in eliminating open defecation is being driven by gains in a fewer high population countries. The progress in those successful countries is commendable, but elsewhere acceleration is needed. While 30 countries are on track to achieve open defecation free status, progress is too slow in 30 other countries. And in 10 countries, open defecation is increasing as the population grows. Open defecation remains a persistent inequality, with 9 out of 10 open defecators living in rural areas and poorer people much more likely to practice it. Sustainable and effective sanitation service delivery is determined not only by the state of infrastructure, but also by complex institutional, governance, and financial management systems. Governance and financing systems needs to be articulated in policy and must be coordinated and aligned, ensuring the sustainability of resources and institutions to support sanitation service delivery. The status of policy and finance for sanitation is regularly highlighted by the UN Water Global Analysis and Assessment of Sanitation and Drinking Water GLAS report. GLAS monitoring informs us that most countries have national policies and plans for sanitation, but few have adequate human and financial resources to implement them. For example, of the 115 countries participating in a recent GLAS reporting cycle, only 3 had policies and plans for rural sanitation with sufficient resources to implement them, and only 5 had sufficient resources to implement urban sanitation plans. While 3/4 of respondent countries cited the existence of a financing plan for sanitation, only about 1/4 said they have financing plans that have been defined, agreed, and consistently used. Further, 80% of respondent countries reported insufficient funding to meet their national sanitation targets. Data from the 12 countries that were able to report quantitative funding gaps by subsector revealed that the funding gap was greatest in urban sanitation, 74% of the total investment needed to achieve national targets, but also significant for rural sanitation, 59%. Fewer than half of the countries reported that the costs of operating and maintaining sanitation systems are covered through existing tariffs and user fees. Just to note, the GLAS report is periodically updated, and the latest data on the WASH enabling environment can be found at https://glass.who.int, including new data available in December 2022. Achieving sanitation for all will require an ambitious and well-coordinated scale-up. History shows that it is possible. Many countries have made rapid progress, transforming lives, the environment, and the economy, all within just one generation. The common success factor has been strong political leadership to set policy, plan, mobilize investment, regulate services, galvanize widespread participation, and continuously learn and adapt towards achieving safe sanitation for all. So, what might be feasible in the next 5 years? A WHO analysis categorized countries into 5 groups according to historical rates of progress for basic sanitation services and asked how many more people could be reached if every country accelerated to match the highest achievers in their group. If countries below the group average were to match the group average and countries already above the group average were to match the highest achievers in their group, an additional 200 million people would gain access in the next 5 years, an increase in coverage of 1.6 percentage points per year, bringing the world much closer to the 2.0 percentage points per year needed to reach 100% coverage by 2030. But with this in mind, goals for health protective sanitation must be based on global research and practice. In 2018, WHO published the Guidelines on Sanitation and Health that collectively analyzed over 1,000 studies to distill what needs to happen in sanitation to make a difference in health and well-being and lay a foundation for social and economic development. The core learnings and recommendations are: first, everyone must use a decent toilet. Second, toilets must be connected to safe systems and services throughout the entire chain. Third, many more sanitation workers are needed. Fourth, sanitation needs to have a higher profile and capacity as a sector, but also needs to be delivered in coordination with other local services to be efficient and sustainable. And lastly, though the lead agency for sanitation may be from any number of national and local authorities, health authorities must fulfill critical functions to ensure sanitation protects health and reduces the burden on the health system. Let's examine how governments can accelerate sanitation progress with proven effective approaches. The SDG 6 Global Acceleration Framework, coordinated by UN Water, has identified 5 accelerators to support the achievement of SDG 6. These are governance, financing, capacity development, data and information, and innovation. The accelerators provide a framework for achieving accelerated progress on sanitation, are proven effective in many places, and collectively summarize a pathway towards countries' achievement of safe sanitation for all with coordinated support of the multilateral system and partners. Let's go through them. First is governance. Good governance begins with leadership, effective coordination, and regulation. Political leadership is key, and here we see the representatives at a recent meeting of WASH sector minister. For governance to be effective, it means sanitation needs to be defined as an essential service for which government is responsible and can be held accountable. Sanitation must be recognized as a multi-sectoral issue, though still one with a clearly defined lead agency and institutional arrangements. For priority to be given to sanitation, it must be included in national policies, strategies, and plans and backed by human and financial resources. The local context needs to drive the selection of approaches and systems. In fact, evidence shows that safe sanitation can be delivered effectively through a mix of approaches and systems. Lastly, governments also have a critical role to play in regulating the sector. Well-balanced regulation is key to ensuring effective risk management while still enabling innovation. A recent success under this accelerator, for example, was the development of the African Sanitation Policy Guidelines in response to demand from African governments. The guidelines aim to provide support and guidance to strengthen the enabling environment for sanitation in Africa. They do this by providing a framework to guide the development of functional and responsive sanitation policies. Second is financing. Identifying and mobilizing appropriate funding sources and financing instruments is critical. Because sanitation is a public good, public finance lays the foundation for services that reach the poorest and galvanizes contributions from households and the private sector. So government investments must be used strategically to attract and optimize other investments, recognizing that most funding for sanitation comes from households themselves in the form of tariffs, user fees, or purchase of their own toilets. There are multiple sources of funds for sanitation that governments can access and combine: taxes, tariffs, transfers, and repayable finance. In addition, governments can leverage private investment by entering public-private partnerships for service delivery. Third is capacity development, which underlies all these other areas to drive progress and sustain services. This means The low emphasis placed on sanitation has resulted in capacity shortfalls, so developing a strong sanitation sector will require a bigger workforce with better skills. Capacity development is more than training. It encompasses human resources development, organizational development, resourcing and research and innovation. Capacity is needed at all levels in line with respective mandates, national and subnational government and private sector. The most effective workforces are gender balanced and diverse, bringing the best skills from across society into the sector. Next is data and information. For sanitation, as in so many other sectors, reliable data support better decision making and stronger accountability. This means high quality data allow governments to target investment, monitor progress, and make timely course corrections. Data is central to developing political will and accountability. Reliable, consistent, and whenever possible, disaggregated data are essential to stimulate political commitment, inform policy making and decision making, and enable well-targeted investments and course corrections when needed to maximize health and environmental and economic gains. Lastly, we must leverage and scale up innovative approaches and systems, including technologies that are accessible for rural areas and marginalized communities. This means new approaches and systems can help to future-proof the sector, making them resilient to disease outbreaks, urbanization, a changing climate, and increasing pressure on natural resources, with solutions that are practical, cost-effective, and scalable. Context-specific implementation approaches and technologies help ensure sustainable services for all. Governments can enable innovation through sound regulation, performance criteria, and standards that reduce risk but do not stifle new ideas and entrepreneurship. So it is up to us, which future do we want? Will we be able to collectively accelerate our efforts and bring all these benefits to society? Or will we continue with business as usual? This illustration from the State of the World Sanitation Report shows two distinctly different futures. On the top is acceleration. On the bottom is business as usual. We will see acceleration when we strengthen government leadership, increase political prioritization, deepen partnerships, and encourage strategic public investment for safely managed sanitation. Thank you for viewing Module 1 of the course For a Healthier World, Safely Managed Sanitation SMS. We hope it has helped you understand the importance of safely managed sanitation, how safely managed sanitation has vital health, social and economic impacts for people everywhere, where we have made progress on access to safe sanitation and improved governance, and where are the gaps. As well, you will have noted what governments can do to make progress to SDG Target 6.2 on sanitation. You can learn more in any of these key sources referenced in this module.